Welcome to Health Focus. I'm your host, Dr. Scott. Today we focus on National Autism Awareness Month. We are fortunate today to have with us Professor Linda Hames, Chairperson of Special Education at Touro University in Vallejo. Dr. Hames is a research psychologist who has extensive expertise in the field of autism. So it's really a pleasure to welcome you today to the set, Dr. Hames.
Oh, thank you.
And maybe you could tell us just a little bit about your career and your involvement with autism. I understand at Touro this is a big research interest.
Yes, and I came there so that I could do work in autism. I had been a researcher previously, and my background, though, has been as a special ed teacher, and specifically for children with autism. I've been a director of a clinic. I've been a consultant all over the state of California for people with autism in school districts, and then most recently a researcher and working at Touro. In my area of research, I really focus on keeping in with the treatment for people with autism.
I should add that Touro has been a real asset to our show, Health Focus. We've had a number of excellent speakers from Touro University, and we were talking off air, and I think we have a bit of a connection to Touro because when I did my residency in New York, I was at a hospital that was an affiliate of New York Medical College, which in fact became a part of Touro University.
Yes,
and I believe you're also from New York originally. So we sort of connect on several levels. So we're delighted to have you with us today.
Thank you.
And let me just start with the sort of simplest question with respect to autism. You know, we hear about it in the news all the time. It seems to get a lot of attention. But what is autism?
So autism is a neurodevelopmental disorder, and it's really characterized by social, communicative, and social interaction deficits, as well as repetitive interest and restricted interest in topics or activities, and it is all present in the early developmental period of life that these are present.
Okay, and it's interesting that if you open a newspaper or watch a show or even look at things such as special accommodations for college admissions, which is something that's been in the news lately, there's just a tremendous public awareness of autism now, a concern about autism. Mm-hmm. And yet that was not the case in previous generations. What's going on with that?
You know, and it's really interesting to see that. So when I first became a teacher, a special ed teacher, back in the 80s, and I said I wanted to teach kids with autism, everyone thought I was talking about artistic people and didn't understand what autism was. Mm-hmm. And now everyone who knows that I'm in the autism field, they all tell me of relatives they have. Almost everyone has somebody in their family with autism. So what has happened is a combination of things. One is much more awareness. There's been campaigns, money put behind these campaigns to make the public aware. If you ever watched years ago, there was the hospital show that was in Chicago, and the actors were involved in Cure Autism Now, and you'd see posters behind them in the hospital talking about autism. And that was really the first time you were really seeing money and campaigns behind awareness of autism. And now you'll see billboards around with some of the criteria. So people will say, I think my child has some of those signs. So, and groups like Autism Speaks, they have really been behind this whole campaign, and they have videos out where people can go and watch videos to see what typical development looks like and atypical development, so that people can start to see what is going on for their kids and say, kind of relief, or say, maybe my child has those signs. So there's definitely much more.
And I understand that autism really is a spectrum of diseases. So it's really incorrect just to say somebody has autism or doesn't have autism without being a little bit more refined in making a diagnosis so that the treatment can be tailored to the individual. So is that correct? It is a spectrum, is it not, Dr. Hames?
Correct. And that's part of also why we're seeing much more of the increase. Not only is the awareness gone up, but also the broadening of the definition of autism has changed. And so now as a spectrum, we're looking at people who have sort of the classic autism, say, on one end of the spectrum, which are often nonverbal, and possibly with cognitive impairment as well, to the other end of the spectrum, which are more seen as some of the people that would, in the past, would have been counted as Asperger's. And now that is under the spectrum of autism spectrum disorder.
So in other words, on the one extreme, there might be individuals who are very highly functioning, who would still have some features of autism, such as Asperger's. On the other hand, you have people who are significantly impaired.
Correct. Yes.
So that really is important, is it, in terms of sorting out who really needs more intensive treatment and so forth. Maybe we can get into that. I understand that the CDC data in terms of the prevalence of autism are pretty impressive. Can you tell us a little bit about how prevalent it is in terms of the number of people, you know, out of 100 or 1,000 that might have autism?
So, yeah, we used to say out of 1,000. We
Right.
used to say out of hundreds. Now we're talking 1 out of 59. So the latest data is that. And really where we have seen the increase is since the year 2000, we've seen dramatic increase in the rates of diagnosis of autism. So, yeah, 1 in 59.
At what age is it typically diagnosed?
So what's interesting, it's on average still between age 3 and 4, and that's often when students will enter, say, preschool, and families really will notice the difference between their child, say, and a typically developing child. But we actually can diagnose autism up at 18 months.
Okay, so at 18 months, there's certain sort of neurocognitive milestones that you expect a child to pass. I guess sort of talking a little bit, making eye contact.
Correct.
Are those the things that are missing? Or?
Exactly. So at 18 months, where you would see, like parents would notice, is they might call their child and their child doesn't respond, and
Right.
might think, oh, my child has some hearing problems. But then they'll be in the kitchen and open up a can of soda, and their child comes in the room, or they open up a bag of chips and their
Right.
child comes. So it's that they don't respond to their name, but they'll respond to sound of things that are preferred items. So that's where they really start noticing, like 18 months, and that the lack of, maybe could be the lack of speech, conversational speech, unusual speech, like echolalia, where they'll repeat phrases that other people have said. And then unusual response to the environment, in that they might pick up a piece of string out of the carpet, start twirling it. Now, infants might do that too, pick at the carpet, but it's the persistence of this and the in total interest and focus, whereas at 18 months, other kids will start playing with toys and maybe using toys in a different way. They might be lining up their toys and not using imaginative play. So really that's where you could start to see some of those.
Okay. I wonder if there might be individuals who are sort of at the extreme of the distribution curve of normality, but who just manifest some of this. I may be mistaken, but I seem to recall reading that, for example, Albert Einstein began to speak rather late. Maybe I'm wrong, but I think I read that.
That is correct.
Would that not be an example of someone who, in today's world, might have been considered at least for autism as a diagnosis, and yet who turned out to have, functioned at a very high level? I guess I'm sort of asking the question, perhaps a bit provocative, but just to get to it, are we overdiagnosing this? Is it being addressed too early in life? What's the harm of just letting the 18-month-old get a little older first before making the diagnosis?
And often people who are on the other end of the spectrum may not get diagnosed at that young age.
Okay.
So their deficits may not be as prevalent at that age. In fact, they can be highly verbal.
Okay.
In fact, extremely verbal and conversational at 18 months.
Okay.
So, and the needs that they may have may not come in until later in life when they are finding they don't know how to establish relationships.
Right.
It could be in preschool. I had one guy I worked with who would only do Thanksgiving dinner.
Oh.
other kids would do role playing and take different roles outside on the playground, and he always had to do Thanksgiving dinner. So that became at age 4, people started going, it's a little unique, but he was highly verbal, highly intelligent. So it's only when it impacts their life and development of relationships that really it warrants potential diagnosis.
So is this typically something then that is relayed by the parent to perhaps a pediatrician or a teacher or somebody for further analysis or discussion?
And so often it's the parent who will notice and will bring it to the pediatrician, but also pediatricians nowadays, it's very, very different. They are on the forefront of being aware of autism and doing developmental screenings and asking questions on the, every time the child comes in at the 6 months and yearly, and we'll ask the questions to the parents and maybe notice some things that are unusual to then follow up with the parent and say, I think we need to do some further investigation on this.
So the increase in prevalence to essentially 1 in 60 or so, that's compared to a baseline of what, say, 30, 40 years ago?
1 in 10,000.
1 in 10,000. So what's going on here, Dr. Hames? Is the disease becoming more prevalent, or are we developing more sensitive methods of diagnosing it, or is it a little of both? What do you think?
That's a good question, and it's actually controversial.
Okay.
So many people believe it's just a broadening of the diagnosis and an increase in awareness. However, there is some research to support that there is, we know that there's a genetic basis. Yes. In fact, 65 genes approximately have been identified to be involved in autism at this point. And every year, different genes are identified. And so one of the things that people are looking into research-wise is called epigenetics, where we're looking at the interaction between genetics and the environment, and what things in the environment are potential triggers or putting people at risk for autism.
Have we found any?
There are a few that, but it's controversial. Some of the studies. Some studies have found things that are at risk, and then some things in the same item, some studies have shown have not found an increase. So, like methylmercury in the environment, there's been 91 studies looking at methylmercury. 74% of those studies have found it to have leading to a higher risk of autism. And methylmercury can be found in fish and in polluted waters, and also can come from batteries, fluorescent lights. And so that may have some role. Again, it's 74% of the studies have shown that. We have 25% that have shown that it's not. So other things that have been associated are also the chemicals found in flame retardants.
Okay.
And flame retardant chemicals have become more prevalent as well because of lawsuits. They're putting in pajamas and bedding and carpets and furniture.
Right.
That's really been a tremendous increase in flame retardants since the 70s. And then potentially certain pesticides. Now again, it's controversial on some of the evidence shows that, and some of the research shows it does not.
Okay, so it sounds like we have to stay tuned as more research unfolds. Now, I understand that once the parents and the pediatrician perhaps have gotten together and discussed these issues, that there are some screening tools that are employed at various levels, I think, in looking over some of your literature before the show, first, second, and third level screenings. Without getting too much into the weeds, are we talking about sophisticated neuropsychological testing, or what does this mean really, and what would be an example of these tests?
So initially it's just a developmental screening that a pediatrician can do, a physician assistant could do that.
Right.
And then we go to a level where it's maybe more detailed, where it's an inventory the parents fill out, like a questionnaire. So again, not major high tech. It can be a 30-item questionnaire that parents can fill out. And it's always good to have multiple people fill it out, the teacher, the preschool teacher, parent, giving perspectives on that. And then there's the next level, which is called, doing like an observation that either a medical doctor, a pediatrician, or a clinical psychologist would do, and this is what I used to do a lot of with doing diagnosis. It's observational, using tools. And right now the gold standard is called the ADOS. And it's a screening tool that's, you set up different situations, like play situations, and observing them in these different little scenarios. And it doesn't take all that long to do these observations and to score them. But you have to be trained to do an ADOS, and that's considered the gold standard.
Okay. Are these tests typically administered then by psychologists, by pediatricians, or I imagine all of the above given the tremendous number of individuals who might be evaluated?
Correct. Developmental pediatricians are often people who would do this, as well as psychologists who have training in this. It could be psychiatrists.
Right.
And then there's different centers that are known for doing this as well.
You know, as a internal medicine physician and physician who treats mainly older people as a geriatrician, I'm also reminded that often in diagnosing neurocognitive issues, you want to do a complete medical evaluation because you mentioned, for example, hearing loss. It would seem to me that it would be unfortunate if a child were diagnosed with autism if the problem were to be something correctable such as hearing loss or some metabolic disorder or something. So I imagine that also has to be at least looked into.
Oh, absolutely. And that's usually the diagnosis, or true diagnosis, is done by a team.
A team, okay.
Yes, you always want to have a team, including a neuropsych evaluation, which also do more to get at your, like an IQ kind of test as well.
All right, so now we've gotten to the point where we've diagnosed autism, hypothetically, in someone, and we're sort of trying to get a more precise diagnosis and so forth, or at least tailor the, I don't want to say treatment, but help the family. Can you tell us a little bit, Dr. Hames, about just the whole concept of autism spectrum disorders? Like, at that point, do you break it down as to whether it's relatively mild or severe, or how do you proceed?
And so in part of the diagnosis, actually now, in the way it's diagnosed, since 2013, we have a diagnostic statistical manual that we use to do this. And they have a level of severity as part of it. So needing some support, significant support, or extreme supports. And so when you do the diagnosis, you're going to get that information. Again, doing a full diagnostic with the team, you're going to get that information and be able to make the recommendations as to what type of treatment is best based on that sort of level of supports, as opposed to in the past it was maybe a level of severity. Now it's really looked at as a level of supports that's needed.
So I'm particularly interested in the more mild ends of the spectrum because just in primary care, I know many parents will express a concern that perhaps their child is not doing well in school, but the child may be functioning quite well socially. But the question is, could this child have some kind of autism? And the term that comes up so often is Asperger's. I sort of associate Asperger's, although I don't know that this is appropriate with the character of Sheldon in The Big Bang Theory. I don't know if that's would be a classical example, but somebody who's very intelligent and high functioning, but has kind of a stiff, awkward interpersonal style. So my question is that about right? Is that what Asperger's is? Tell us what it is exactly.
So, yeah, what you're describing is very much that character really does. People who watch the show will say, oh, yeah, he has Asperger's. Now, he very much does display a lot of the characteristics of somebody who would be considered Asperger's. Now, we are no longer diagnosing Asperger's. It's autism spectrum disorder. And when you look at a character like Sheldon, he has some of the social deficits, and he can misinterpret people's actions, and he can't read their emotions.
Right.
And he says things that are offensive, and he doesn't intend to be offensive.
Right.
And so, but he also has that intense interest. One, in the physics, which makes him a good physicist, is that ability to have that intensity of focus, but also in his interest in the superheroes and Star Trek and those areas too.
So Dr. Hames, I understand you brought a few, are they audiovisual aids or are they therapeutic tools? Can you explain them?
Exactly, they are therapeutic tools. And the reason why I brought them is, so back when people were unaware of autism, we used to spend a ton of money to get items to provide sensory calming for people with autism, and we had to buy things in catalogs. And I really wanted to show with the awareness and the broadening of autism that these are readily available items that you can go into this is from a Brookstone store, and it has, sand, and it's very satisfying that you can play with the sand and mold it. And some of the other items, this is a handmade kind of.
Wow, that's really cool.
And it doesn't stick, and it just goes right back, and you're clean. And this is for all areas of the spectrum of autism that this can provide some calming. You have thinking putty. Again, you get this in any toy store, homemade toy store. All of these are items. I have to show you this. This is so satisfying. You squish and it slowly rises. And I got this on Amazon, and I bought 15 of these for about $20. So just readily available in any toy store. All of these different items that the old rubber chicken, that good squeezing that you can keep in your backpack, in your desks, carry with you, and you don't stand out as being any different than anyone else. And I think it's wonderful that these are sort of commonplace items now, and inexpensive and homemade, and everyone is using them.
How would these differ from just normal toys for a child of the same age?
So that's the thing. They aren't any different nowadays. But for if people are buying them and using them as well for some of the same kind of reasons that people with autism might use them, to calm, for satisfying. So you're in class and you get stressed, you have anxiety. You can put your hands into this tub, and the teacher is doing a lecture, and you're just doing this, and it's calming you so that you can attend to the content. And other people might be doing the same thing.
Are these intended for children or adults or both?
Both.
Okay.
They're quite popular among high schoolers right now, too.
Really? Okay. Mm-hmm. Believe it or not, our time is just running out so quickly. I feel like I have so much to ask, but let me turn to treatment. Is there treatment for individuals who have autism? What can be done to support their families and help these individuals?
So, importantly, 30 years of research, we've shown that using applied behavior analysis is the most effective intervention to help individuals and families with autism. Now, this may not be for the people on the far end of the spectrum who don't need help as far as developing language skills, but for anyone with sort of the classic autism, it is the most effective treatment for developing interaction skills, language skills, and being able to function in the world.
How about medication? Do medications play a role in the treatment of autism?
So not necessarily in autism per se, but in some of the characteristics of autism, some of the things that go along with autism. They can treat some of the symptoms. So there's medications that can, so again, more the classic autism, and a lot of the students I work with can be self-injurious and aggressive, and so Abilify and Risperidol are common medications that are used to decrease what they call the irritability, which is manifested in aggressive or self-injurious behavior. So it's very effective for some of those symptoms, as well as anxiety and OCD.
And Dr. Hames, how about research? What future research is on the horizon for diagnosis, treatment, or prevention of autism? I realize that's a huge one to ask, but I know that about a number of genes have been found, for example. So are we going to have selective screening? Are we going to have better prenatal care? What do you see happening?
Oh, that's a good question. There is so much being done genetically, and also recently looking at functional MRIs. And I think where we're going to is going to be identifying subtypes. And as we can better identify the subtypes in autism, we'll be able to have better treatments.
Are you optimistic about the future in terms of diagnosis and treatment of autism?
Oh, tremendously optimistic.
And as we wind down to the end of our brief time together, can you offer any suggestions for where individuals or their families might go to get more information about autism or support, either at Toro or in the community or at any websites?
Well, certainly they are welcome to come to Toro, to contact me at Toro, and to see our website at Toro University. But I would also recommend for families to look to Autism Speaks, their website. They have a really tremendous wealth of information geared towards parents and families, as well as looking towards their local regional centers for support and assistance.
Dr. Linda Hames, I feel that I really asked so much of you in such a brief period of time, covering such an enormously complex topic, and you did not disappoint. It's been really a privilege having you join us here on Health Focus, and I hope you'll come back and see us again soon.
Oh, thank you.
Thank you so very much.
Oh, thank you.
Remember,
Wonderful.
here on Health Focus, we focus on your health. We've only had half an hour today to explore Autism Awareness Month, but I think it's been an enlightening half hour, and we really appreciate having you here with us to explore this topic with our distinguished guest, Dr. Linda Hames. We wish you all the best of health and look forward to seeing you again. Until next time, stay healthy, and thanks for joining us.